Okay, so today we're going to do bone fractures and repairs. So basically we're going to talk about what type of breaks you may see in the real world setting, and then how bones actually heal themselves. Come on. Hang on just a second. All right. Okay. When you talk about a bone fracture, you can classify bone fractures, and there's like 4 categories of either or. Okay, and we're going to go through all 4 of those, and then we're going to look at some examples of bone fractures and see if we can classify what type of fracture they are. The first thing you look for is the position of the ends of the bone after the fracture. Okay, is it non-displaced or is it displaced? Okay, so if this is a fracture, is there a break there? If these ends are still together, then it's non-displaced. If this is your fracture, and they're not together anymore, that's displaced. So they're out of normal alignment. Pretty straightforward. Okay, so here you go. So here's a non-displaced. You can see there's a break there, but the bone ends are still together. Here's an obvious break, but the ends are no longer together, so it's non-displaced. All right, classification, you can also classify it by completeness of the break. Is it complete all the way through, or is it incomplete? It's not going all the way through. It's halfway or 3/4 of the way. It's not all the way through. Here's a picture of a complete. You can see it goes all the way from one side to the other, complete break. And here's one that only goes about 3/4 of the way. This one's actually called this one's a green stick break. And a green stick refers to, think about like a spring tree. If you take a branch and it's been laying there in the fall and it's really, really dry and you snap it, what does it do? It breaks in half. In the spring, if you got a green branch and you try to break it and it bends, what does it do? It might splinter, but it won't break all the way through. I mean, you got to really, really try to break it. So in especially children, as their bones have not completely ossified, they're actually a little more flexible than ours. So you're more likely to see a green stick break in a child. They may have a really traumatic fall, and their bone may actually break and just actually bend and not break all the way through. So that's called a green stick. So it's non-complete. Okay, you want to look at the orientation. Look at the long axis. So here's your bone. This is the long axis. All right, so along this line. Is the break linear? So is the break in this direction? Or is it transverse? Is the break in this direction? So here's an example of a transverse break. Here's an example of a linear break. And there's a third category called a spiral break. You can see it's basically or oblique. You might want to use the word oblique. So a spiral break. Now before we move on, let's look at this transverse break. Based on what I just told you, there's other ways to classify this particular break. Okay? It's not only transverse, it's what? Complete and non-displaced. So if you have that, somebody says, yeah, I had a transverse break of my femur, it was also complete and non-displaced, you would have a really good picture of what that looked like. You would know what kind of break that was. On this spiral break, it's complete, broken all the way through, right? And it's a little bit displaced. It's separated. Okay, they're not together anymore. They're not actually physically touching. They've actually moved apart. Now, a spiral break is more likely to come through the skin. Now, let's imagine this was the leg. Think about a spiral, because that's a femur, a spiral break. It's that sharp edge. It's more likely to break through the skin, and we're going to talk about those kind of breaks. Another thing about spiral breaks, you tend to see this if a child has a spiral break of an arm. Child abuse. You want to think about child abuse. That means parents like, come on, they've grabbed the kid and twisted their arm and snapped it. And a spiral break a lot of times is an indication of some type of abuse, unfortunately. All right, the last thing you look at is it compound or simple? Do the bones penetrate the skin, or are the bones still basically inside the skin and muscle? If they penetrate, if they break the skin, it's called compound or open. You can use either or of those terms. If it's still inside the skin, still inside the muscle, it's simple or closed. So here's an example of a compound break. You can see that's a spiral break. Okay. Here's an example of a closed break. Now, what other terms can you use to describe this break? It's compound. It's also open, because some people use compound, some people use open. It's spiral. It's complete. And displaced. So that's a lot of information, okay? Instead of you just got a broken bone. You can tell somebody all of these terms, and then you really have a good understanding of what kind of break it actually is. All right? There's another break here I'm going to show you. This is called a comminuted. And that's basically a break that is into many, many pieces. It's still together, but it's broken up into many, many pieces. This one's probably let's just describe this one. It's simple or compound? It's simple. Open or closed? Closed. Complete or incomplete? Incomplete. Displaced or non-displaced? Non-displaced. So see how you can do this? You can look at a bone fracture and describe it in more than just one way. All right, some other terms you're going to see. You want to see, you want to know the location. Okay? Is it a proximal break? So if I say the proximal end of the diaphysis of the femur, so here's my femur. If I say you have a complete break at the proximal end of the diaphysis of the femur, what's the diaphysis? The shaft. What's the proximal end? This side. So you have a break somewhere in this general area. That tells you automatically it's not a break in this part of the bone. It's up toward the top. Okay? So you're looking at location. You're looking at the external appearance. Okay? Can you see the bone sticking out of the skin, or can you? Sometimes even if it's closed, if the bone's not sticking out of the skin, you can see it pushing on the skin. It hasn't broken through, so you know it is displaced. Okay, so if you see a bone and it's protruding, it hasn't broken the skin, so it's still a simple fracture, but you can see that it's displaced, and you can see if it's complete or incomplete. So there's a lot of different ways to describe a fracture. Now another one you may see, especially in you'll see this a lot of times in boys going through puberty and just in their early 20s when they're really doing more than their bodies can take. They're trying to lift something heavier than they need to. And an avulsion is basically when a portion of the bone breaks off with the tendon. So here's the bone. Here's the tendon. Tendons connect muscle to bone. Tendons connect muscle to bone. Ligaments, let me go ahead and say that. Ligaments are bone to bone. So the tendon's connected to the bone. The muscle has contracted. You've done something. You've lifted something too heavy. And instead of the muscle ripping and tearing, it basically just ripped a part of the bone off. And that happens quite commonly, like I said, in especially 18, 19-year-old boys who are showing off and trying to lift something too heavy and breaking off a bone. An aponeurosis is a sheet of fibrous tissue between a muscle, and I'll show you one of those when we do the muscles. All right, so example of some other types of breaks. I just mentioned the comminuted. Okay, that's when a bone breaks into 3 or more pieces. Okay, so you can just kind of see this is it almost looks like it's crushed. You can imagine maybe it's common in older people whose bones have become brittle. Maybe they've stepped off a curve too hard. They've kind of lost their balance, and they've kind of put all their weight on one foot, and it just kind of crushed the bone. Just causes it to break. It kind of shatter. So if you think of you ever heard of the word shattered bone? Comminuted would be the better way to describe that. than a shattered bone.
Earlier when you showed the linear break,
Mm-hmm.
how would what you just described would cause that?
A linear fissure break, that can be typical of a stress fracture. So overuse and overuse injury. It could be. You can get a fissure break also. It could be a crushed break too, depending on the angle that you had impact. An impact break. It could cause it too. Usually stress fractures. A compression is basically a crushed injury, and that's really common in porous bone. Okay, so it's not necessarily pieces. It's just compacted. It's just kind of crushed down, and you'll see that in especially vertebra in osteoporotic people. I mean, over time their vertebra will just crush on their own. They don't even have to have an injury, or traumatic injury. A really traumatic fall or car wreck may cause a crushed vertebra or a crushed bone, which is also called a compression fracture. You may see a depressed fracture. And that's where a bone, typically it's a skull fracture, and basically it just depresses in the bone. It just basically, think about this guy was maybe hitting the head with a baseball bat, and it just basically pushed in the skull, okay? It just pushes that bone inward. And a lot of times they don't necessarily do anything about that. The bone may actually still be kind of intact, and it's still protecting the brain, and they'll just kind of let it heal on its own. It will never pop out. It will always stay depressed. So depending on the severity of that depression fracture, they may or may not do anything. My grandfather had a depression fracture. He worked in the steel industry, and an I-beam that they had just finished making, they were carrying it across. You know, they hang them from the ceiling and they, what do you call that? Carry them from one end of the building to the other. Anyway, the chain broke, and that I-beam fell and hit him on top of the head. And miraculously, he survived, but he had an indention in the top of his skull about that deep, right along the sagittal suture. Okay, so look, if you look at the brain, there's actually two hemispheres. There's actually a division between the brain right there. And so basically it just kind of went down into that division of the brain. And this was back in the 1960s, and they didn't try to heal. They let it heal on its own. They didn't think he was going to survive in the first place. Well, he wound up living. And so to this day, he's dead now. But when I was little, I used to love to put my fingers, because you could feel it. I mean, there's just like this big, ridge right down the middle of his skull. And that's a depression injury. Like I said, they didn't fix it. It just.
My grandfather was missing a finger and we used to play with that.
Yeah, I mean, it was just cool. Then you take his teeth out. I mean, grandparents are cool, I know, they take their teeth out, they have holes in their head, and all that kind of stuff. So that's a depression. You'll see that. That's really typical. That can be an industrial accident. That's why you wear a hard hat, okay? So, all right, so I talked about green sticks. That's basically an incomplete break. Think about a green twig. You bend it and only breaks on one side. It won't go all the way through. And like I said, real common in children because their bones are just more flexible. You can see just a little bitty break. So it's incomplete, green stick, non-displaced, still in the same place, break. Spiral break, here's another example with an x-ray. You can see this usually almost oblique. Sometimes you'll see oblique. Sometimes you'll see oblique written down. Common sports fracture. You'll see it, especially in it's a torsion. If you have somebody twist a leg or throw in a ball, some kind of a twisting motion. Again, also indicative of child abuse. So sports fracture or child abuse. And then an epiphyseal break. Where do you think that break occurs? At the growth plate, right along the epiphyseal line. Remember, that's just a little thin strip of cartilage. So that's actually not a really strong part of the bone. So you might have a break, it tends to break where that cartilage is, and basically the bones just snap along where between the epiphysis and the diaphysis. Right along that growth plate, you're going to get a break. Many times they wind up being complete. Not always, but a lot of times they're complete, and a lot of times they're displaced. But not always, but more often than not. Okay, when you treat a bone fracture, you treat it by what's called reduction. That's the treatment for treating a bone fracture. If it's a closed reduction, that means without surgery. So basically think about they manipulate the bone, put it back in, from the outside. They can just kind of wiggle the bones. They get them back where they want them to be, cast it up. All right? Very common closed reduction. Open reduction means surgery. And usually they're going to have to put in some kind of pin or nails or screws or something to hold that bone together. So open reduction always requires surgery. Closed reduction is no surgery and usually a cast or some kind of a brace. All right, so how does a bone heal? We're going to talk about the different stages of healing that bone. The first thing you're going to get is a hematoma. Okay? That's basically like a blood clot. All right, so the vessels are going to hemorrhage, going to bleed out into the broken area, and a blood clot or hematoma forms. Usually it's going to become swollen because you think you got all that blood in there. It's painful and usually inflamed. The body's trying to heal itself, and the signs of inflammation. Anytime the body tries to heal itself from a cut or a break is usually with swelling, pain, and redness. And sometimes heat. Why would it be hot? Yeah. Well, that's what it's trying to do. Why is it hot though? More blood there. There's more blood sitting to that area, so it kind of heat tends to make that area warmer. Okay, so this is a break. So we've got basically this is this is almost transverse, a little bit spiral, but we'll go with transverse break. It is complete. It is closed. So it's a simple break. So you've got the break, and the first thing you're going to see is all these blood vessels, because remember there's a lot of blood vessels inside of a bone. They bleed out, and you form this blood clot, or this hematoma.
That's why people bleed to death when they work with
Can, yeah, you can. It's just a lot of blood. A big bone that breaks can be. You don't necessarily. I mean, that's the yeah, you can, because the bigger the bone, the bigger the blood supply. Okay, and it depends on which bone it is. So a hip fracture can be a lot of bleeding. A femur fracture can be a lot of bleeding. The next thing you do is you get a fibrocartilaginous callus. So this is basically what happens is you get this callus made out of cartilage. This kind of goes back to how bones are made. What do you got to put down first before you can make a bone? Cartilage. Okay, so you're going to put down this fibrocartilaginous callus. You're going to have, I know, say that for 3 times fast. Fibrocartilaginous callus. It's like supercalifragilisticexpialidocious. The next thing, you're going to get these phagocytic cells, and those are like macrophages, those big eater cells, or like modified white blood cells. They're going to come in and they're going to eat anything that needs to be gotten rid of. It could be bacteria, it could be extra tissue. They're just going to clean up the area. All right? Get the area cleared of debris. The wrecking crew comes in, cleans it up. Osteoblasts will come in there. They make bone. They start forming spongy bone. Then you get fibroblasts coming in. They secrete collagen fibers, and that basically connects those bones together, makes it strong, brings those bones together and makes it stronger. And then now you're going to start repairing that. So let me get a picture. So here's your break. Okay, so you've had your hematoma. The phagocytes have come in there and cleaned out all the blood clot. They're cleaning it up, getting rid of whatever extra blood, the old scabby blood that needs to be gotten rid of, any extra tissue or little broken bits of bone. All that's being cleaned up. You're putting down this fibrous cartilage, this fibrocartilaginous callus. That's being formed. Okay, new blood vessels are going to start to migrate and grow in and connect and fill in the spaces. Okay. And you're going to start putting down little spongy bone. All right. Now, after you've made the fibrocartilaginous callus, then you make a bony callus. You're basically going to completely replace that fibrocartilage with actual bone. So now you're going to lay down trabeculase, spongy bone, and make a hard callus. And this is going to take up to about 2 months. So it takes about 2 months for a break to fully heal. So within the first week, from the first 24 hours, you've got the hematoma forming, okay? Then within the first 48 hours to 2 weeks, you start to see that fibrocartilaginous callus be put down. And then after about 2 weeks to 2 months, that starts to be changed into a bony callus. That fibrocartilage turns into bone, or is replaced by bone. So here you see we've gotten rid of that hematoma. That cartilage is starting to disappear, and bone is starting to fill in where that cartilage was. So this is our hard callus. And usually somewhere between the first and second week, this is going to start to form, which is why it's really important to get that cast or whatever you're going to do, whatever surgery, within that first, 24 to 72 hours, because that healing begins pretty quick. And if your bone was displaced, okay, it's going to start healing together, but there's nothing there to start healing to, all right? So you want to make sure within the first 24 to 48 hours, you've been to the physician, and they've been able to put those bones back in alignment so that when that healing does begin, it actually does some good. If you wait, you break your bone on Thursday, and I don't know if it's broken, I'm not sure, it just kind of hurts, blah, blah, blah. Finally, next Tuesday, you go to the doctor, they're going to have to re-break it pretty much, okay? They're going to take, that fibrocartilage is already starting to form. They're going to have to go in there, usually surgically, and re-break it and realign it and get it started.
My son broke his
Mm-hmm.
in spiral displaced break when he was 3 years old. And they put him in a traction for 6 days before they took him to surgery.
Mm-hmm. Why the traction? Probably to give it more room to stretch those muscles a little bit so that when it did go back, it would hold better. Because those muscles were probably, when the bone broke, the muscles then contracted. And so here was your femur before. It broke, here's your femur now. Put it in traction, keep those bones separated, stretch those muscles a little bit so that when they do put it together, it'll hold better. All right, so once you've gotten the hematoma formed, you put down the cartilage, then you replace the cartilage with bone, then you have to remodel the bone. You've got to basically reshape it and make it look like it did before. Okay, so you're going to do the bone remodeling so that your final structure looks like it did before. And so here you go. So you had a broken bone, you've gone in, you put down the scab, you've gotten rid of the hematoma, you put down cartilage and you put down bone, put down that spongy bone. So in the remodeling stage, you came along and you put down, what's this bone on the outside? Compact bone.
I'm sorry.
Compact bone. So you came in, remodeled it, and put in your compact bone along the outside. This is what really gives your bones strength. This compound bone, or got me saying it now, compact bone.
Sorry.
This compact bone gives your bones strength. So it goes along the outside to give you more strength. So that remodeling occurs to strengthen your bone. All right. So here we go again, just one more time. Got your hematoma, put down your cartilage, replace your cartilage with bone, remodel it, reshape it, put down your compact bone, and you're healed. And this can take anywhere, from here to here, can take anywhere from 2 to 6 months, depending on the size of the break, the completeness of the break, the size of the bone. So anywhere between 2 and 6 months. So you'll see some people in a cast for, 4 weeks, 8 weeks, 6 weeks. It just depends on what the break is and how severe it is. All right, cool, we're done.